Good morning, everyone. I'm Candace Brake with the Greater Owensboro Chamber of Commerce. We're really pleased to be able to present this webinar to our members today with regard to our recent public health situation and COVID-19 in the workplace. We have with us here today Clay Horton, who is the Public Health Director for the Green River District Health Department. And Clay is, but prior to being in that position, was the Director of Environmental Health. He's got a bachelor's degree from Murray State University in biology and chemistry. Wow, impressive. And an MPH, a Master in Public Health and Environmental Public Health from Western Kentucky University. Clay is one of the best and the brightest from our community that went away and got educated and came back to make a difference here in his hometown. And Clay, just before we start, I want to tell you how proud we are of you and your team and the job you've done. You have honored our community with your professionalism and really your servant leadership. We appreciate you so much. So I will turn this over to you, and you can open us up. Thanks, Clay.
Hey, wow, that was humbling. Thank you. I didn't expect that.
Well,
But appreciate those kind words, and really, we've got a really good team here at the health department. It's been working really hard for 8 or 9 months, and they do it because they have the best interest of the community at heart. So I appreciate the opportunity to do the Q&A with you all today. I know you get a lot of questions from your members. We get lots of questions from businesses and the public in general here at the health department. And so any opportunity we can to get word out and try to give people direction and some guidance on how to manage this crisis, then we're happy to do that. So in terms of cases and spread in our community, things have been really escalating here the last probably 2 months, and we are at a critical point. And I feel like I've said we're at a critical point a lot of times over the course of the pandemic, but that's been, it's more true today than it ever has been. I think this morning we're going to report out 129 new cases of COVID-19 for our district, 5 new deaths. So, we are really starting to see the effects of this. The state has been promoting their incident rate map as a way for communities on a county by county level to gauge the level of risk in their local area. And they set the threshold of 25 cases per 100,000 per day as being a red zone category. And Davis County and our Green River District Health Department consistently over the last week have been between 50 and 60 cases per day per 100,000. So we're double that rate of that red zone threshold. That's not unique to our region. The entire state is seeing similar rates of spread. I think 117 of 120 counties last night were in that red zone category. We're seeing incident rates of 60 to 80 cases per 100,000 per day across the river in Indiana. So it's
With regards to the numbers, you told us that we're like between 50 and 60. What percentage of the actual cases are the ones that you confirm? Do you have a kind of a ballpark?
Yeah, so based on data that CDC and other researchers have collected through the pandemic, we think that that's probably between 10 and 20% of the actual cases. So multiply that by between 5 and 10. And so, we're in Davis County, we're a little over 3,000 cases this morning for the total of the pandemic. So that's probably somewhere between 15 and 30,000 actual cases. So it's a huge number. A lot of people don't even know they're sick. A lot of people get over it on their own, never seek care, never get tested. And so, what we see in terms of our surveillance is the tip of the iceberg.
Thank you.
Yeah, so with those, because of the rate of the spread, you are seeing some policy level changes at the state level. I think everybody's aware that on Friday, the governor signed a new executive order that put in some additional restrictions. So we're asking people to continue to sit up and take notice and make changes so that we can slow the spread of COVID-19 in our community. Some of those changes included not having indoor dining in restaurants. Asking business, office-based businesses to go down to 33% within the building. Making sure that people keep informal gatherings, either not have gatherings with people outside of your household, or if you do, make sure they're very small and you don't include more than 2 households or 8 people. We've asked gyms to scale back to that 33% level and asking people to wear masks even when they're at the gym. I know it makes it more difficult for your workout, but it also is a good infection control, step. And then the big one was asking schools to go to remote learning. That impacts more than just people that work in the school system or those that have school age children. That has ripple effects through the entire community, and I think we're all feeling that this week. So, a lot of the questions that we see from businesses through the course of working cases the last 8 months, we've gotten to know a lot of partners in the business sector. We've gotten to know them pretty well. Unfortunately, a lot of them have gotten really good at managing cases in their workforce because they've had that experience and they've had to gather that. But what we really kind of want to share is, with the level of spread that we're seeing now, the number of cases that we're seeing, the whole system gets bogged down. And I'm not talking about just the health department. We see slowdowns from the hospitals and other providers in terms of reporting. We see slowdowns with labs because they're inundated with a number of tests. We've even had trouble with UPS shipping lab samples with us the last couple of weeks. That's probably related to holiday shipping as well. But the result of all of that is that sometimes there's a delay in getting notification from the health department or getting that one-on-one assistance from the health department. So, what we want people to know is what to do when you find out that you have a positive case, either in your family or your workforce, and how to manage that. And it's complicated, but yes, it's simple at the same time. The most important things that you can do is that if you have someone that tests positive, that they need to isolate, they need to stay away from other people. Even within their own household, they should try to get to a separate part of the house and separate them the best that they can from the rest of their family until they recover. And then identify anyone who's had close contact with them that could be at the highest risk of developing COVID-19. And obviously the highest risk are going to be those that they live with. Very difficult to control spread in that environment. And then the next level would be anyone that they spend a lot of time with. So if they've had this close and prolonged contact, they've been within 6 feet for more than 15 minutes, we would deem that as a high-risk contact. And those individuals need to quarantine. And what that means is they simply need to stay away from other people. They need to stay home for 14 days from that last date of contact. So if you know those few points, you know what to do when you first find out about a case in your workforce or your family. And that buys you some time until you hear from us at the health department. And kind of address those individualized questions that always come up.
Okay. So if somebody feels like they've been exposed to the virus, how soon, say I got exposed to the virus yesterday and I found out about it. How soon do I need to get tested and feel accurate that that's an accurate test?
Yeah, so there is an incubation period with this virus, and that varies. And so that makes it very difficult to determine that. I would say no sooner than 4 days. Okay. So probably between 4 and 7 days would be a good window to get tested. But the other thing that's important to keep in mind is if you think you've had a high risk exposure, for example, somebody in your household or somebody you've spent a lot of time with, even if you get tested and you test negative, you still need to quarantine for 14 days because that incubation period varies. The sensitivity of testing varies depending on what type of test you get and seek out. It seems like it was 2 years ago, but it was only 2 months ago, but we had this real high profile cluster at the White House. And you can probably recall the news cycle that week. Every day you'd hear about a few more people that had worked in the White House or had been in the White House would test positive. All those individuals are getting tested every day. And a bunch of them would test negative, and then the next day they would get tested and they would test negative, and then the next day they'd get tested and a few of them would come up positive. And that's because the virus, develops at different time frames for different individuals. And sometimes there's a delay in terms of when you can actually detect that, and the test is going to be effective in determining that they're positive.
Okay. So, some of these will be reiterations on specific questions that members have submitted. Okay. And these are actual things that have happened recently. If an employee spouse tests positive, what's the protocol for the spouse, for the employee to return to work?
So if the employee spouse tests positive, in most cases, almost every case, that's going to be a high risk contact. So the person who did not test positive but had that high risk exposure needs to stay home for 14 days from their last contact with that positive individual. So that gets very specific on individuals' circumstances. So if if the spouse is effectively able to isolate while they recover, and doesn't have daily contact with their spouse, the clock would start that day that you find out. If they can't do that, then really the 14-day clock starts when the person is recovered and no longer infectious. So that's where I talked about it's simple, but it's complicated. Every one of these specific situations, you have to look at the calendar and you have to make that determination. But if you got a call today that one of your employees' spouse was positive, they should go home and they should stay home for 2 weeks.
Okay. So, and this is probably out of your purview, but is an employer required to compensate that employee that has to stay home for that length of time?
We certainly would encourage it. We don't want to force people to come into work while they're infectious and potentially could infect other people in the workplace. So we would encourage it. And I think it'll depend on your own personnel policies and labor contracts and those type of things that will determine whether it's required or not. I can tell you that here at the health department, we've made the decision that we didn't want to put people in a hardship, and we didn't want to pressure them to come in and work to where they potentially could infect other people, and we are paying them while they're in that quarantine period or isolation period.
Okay, great. So this too will be maybe a little bit redundant. At what point should you tell an individual not to be at work if they have been exposed to someone who tested positive?
Well, if it's a high risk exposure, so if it's somebody within their household or someone that they were within 6 feet for more than 15 minutes, then during that infectious period, when we talk about the infectious period, that there's sometimes that's when they're symptomatic or the 2 days prior. That would be the point when I would say they need to be excluded from work and they need to quarantine for 14 days.
Okay. So if you find out that someone in your workplace is having symptoms, okay, and the employer asks them to go get a test, where's the best place for employers for us to recommend for our employees to go be tested?
So there's a lot of opportunities to get tested in our community, and depending on which particular day it is, there may be some that are easier than others. But we do kind of no questions asked drive-through testing here at the health department. We've been typically doing that on Wednesdays. We're going to do it on Tuesday next week. Tuesday this week. So today, and the hospital does testing. They have a COVID hotline that's on the front page of the paper every day that you can call in, and you'll talk to a nurse and they'll triage you. Just about every urgent care in Owensboro is providing testing. The Audubon area community clinic provides testing. Health First is providing testing. Our pediatrician offices are ordering testing. So I would say if you're having symptoms, call the hospital's hotline, call your physician's office and ask them where they would direct you to go. Or call an urgent care, or check the health department's website, healthdepartment.org. But like I said, there's no one single source, but there's a good patchwork of sources throughout the community where there's ample testing available.
Good deal. And with regard to the OH and the health department testing, is that by schedule, or can you just show up in your car and be tested now?
So both of them are scheduled, and both of them are doing drive-through testing. So you do need to get an appointment, but you just show up in your car and get tested. So for us, go to healthdepartment.org, which is our website, follow the prompts for scheduling a COVID-19 test, and you pick a time slot. You get an email to confirm, and you just drive in. Most people are in and out in under 2 or 3 minutes.
I've done it 3 times, and it is so easy and efficient. The staff's great.
Yeah. And then the hospital, call the hospital's hotline, or call your physician's office and follow their directions.
Okay. And so with the fees for testing, Clay, what are the testing fees?
So through us, there are no fees. We're not charging anyone or doing any kind of billing. Most medical providers are billing your insurance. And for most people, there's no out-of-pocket cost. Insurance typically pay for the testing. If you have folks that are uninsured, there are programs that will support that. I mentioned Audubon area and Health First. They're both federally qualified health clinics. They both provide services to people that are underinsured or uninsured. But I don't let the ability to pay be a barrier. There are opportunities in the community where you can get tested if you need to.
Okay, great. There's a couple of questions from a healthcare organization, and I feel like we've probably answered these, but from the time of direct exposure, when should you get tested? And you had said after 4 or 5 days. Is that right?
Yeah, 4 to 7 days. But let's not forget even if you get a negative test, that does not negate the need to quarantine, because just the test is a snapshot in time. That means you were negative, or they could not detect the virus at that particular moment that you were swabbed. That doesn't mean that later that afternoon or the next day that you're going to turn positive. So they're both important steps. Getting tested to find out if you know you're infected, but also staying away from other people for that 2-week period, so that in case you do become infected, you're not going to continue the spread.
Great. So if you are symptomatic and you don't have any taste or smell, some kind of symptoms like that, can you still receive a negative test result?
Yes. The tests are not perfect. The PCR test, like we're doing through our drive-through, most of the testing that they're doing at the hospitals, PCR. Most of our providers are doing PCR. That's the gold standard. They're very good. But if the swab didn't pick up enough particles of the virus, so that they can't, when they do their analysis, they can't detect it, it's possible that you're still infected. So if you're symptomatic, you should probably stay away from other people until you're well. And definitely want to get tested. And even if that's a negative test, if you're still having symptoms, you still want to be very careful.
Absolutely. It's just the right thing to do for your coworkers. Does the employer have to pay the employees during quarantine?
So again, I think we would encourage that. There's going to be, depending on your employment contract and your own particular situation. But what we don't want is to pressure people to come to work when they could be infected. So we would hope that people could offer sick leave and paid benefits for those that have to miss work because they could potentially expose others.
So say that you have an employer that gets a positive result for one of the employees. What does that employer do for the rest of the workforce that they have?
So that's a great question. Obviously we'll want the positive employee to stay home while they're sick. And then we would ask the employer to try to identify if there were close contacts within the workplace. And hopefully at this point, we're all doing everything we can to eliminate those close contacts. We're wearing masks when we're around other people. We are spacing out our work area so that we're not within 6 feet of each other. But if you do have close contacts at work, you want to identify those individuals, you want to share with them that they potentially are exposed, and you want to ask them to quarantine for that 2-week period.
Clay, the 6 feet for more than 15 minutes, does that mean masked or unmasked?
So currently with CDC guidance in a community setting, it's a little different for healthcare. That 6 feet within 15 minutes is irrespective of mask use. So I don't want you to hear that and think that masks are ineffective and we shouldn't be wearing masks, or we're discouraging anyone from wearing masks. Masks are an effective intervention. They are a good preventative step. There's lots of data to support that. However, so is quarantine. So it's kind of a belt and suspenders approach here, in that, just because everyone was wearing masks doesn't mean that the risk is zero, and we still want to be very careful, and anyone that's potentially infected needs to quarantine.
We did have a member that's written in that the COVID Act, I guess it's the CARES Act, provides credit to employers on Form 7200 or 941 for COVID pay to employees for up to 2 weeks. And we'll look into that too, and see what we can do to provide that. But there should be, we have had tax credits, that situation for people. There are some things that you can do specifically if they have to stay home, or if they have to take care of a sick child or a sick relative. There are tax credits available for the employers on that as well. So with rapid tests, we have a lot of businesses in the community that if the rapid tests were available, here, that we'd be able to probably return back to work. But you're saying even if you've been exposed and you get a negative result, you still need to quarantine.
If it's a high risk exposure.
Okay.
So we have to make the determination on how high that risk is. But the rapid tests are a very good tool for someone who's exhibiting symptoms or has a known high risk exposure. It gives you a result within 15 minutes, depending on the test. Sometimes that helps speed the decision-making process. These rapid antigen tests aren't as, accurate as the PCR test, but they still have some advantages because of the speed. The PCR tests right now, I think most of our providers here are still having to send those out to a centralized laboratory. We're getting our results usually within 24 to 48 hours. I think that's pretty typical turnaround for other providers. The hospital is working on having that capacity in-house, and that should be up and running pretty soon. So you're probably at that point looking at a 4 or 6 hour turnaround once that capacity is available locally. But the rapid tests are a good tool. They're becoming more widely available. The hospital and other providers in town already have that capability. But I think that sometimes you want a skilled professional making the determination which a test is appropriate, which time, and when speed is the objective, then that's a good solution.
Yeah, it really can at least it gives you that time, extended time to be able to make a good plan for your workplace. Are you allowed to provide catering for indoor events that are less than 25 people per room?
So I don't know that the executive order that the governor signed last week is specific to that. I think that my answer to that question would be to look at the big picture here and what are we trying to accomplish as a community. So the reason that we don't want or we ask folks to pause indoor dining is we know that can be a high risk setting, not necessarily for those in the business, but sitting down for an hour unmasked, eating and drinking is a pretty efficient way to spread COVID-19. It's safer outdoors where you have more airflow. It's safest when you're in your household just with your other household members. So what I would say from what we're trying to accomplish, if it's an indoor setting, it's a group of 25. I'm assuming that that's large enough that we're mixing other households and that they'll all be sitting down, eating and drinking with masks off. That would be a higher risk situation that we would discourage.
Okay. So let's talk a little bit about masks. We've received a lot of calls from different size organizations on masks. And I feel like one of the misnomers of that is a lot of folks think if we're all part of the same office, we don't have to wear masks because we're kind of a work family. And we did have an exposure last week. We've had several with some members where there was the staff, they wouldn't wear masks when it was just them, but when they would open, then they would wear masks.
Open to the public, they would wear masks. Yeah. So, I think that we all have to be conscious of when we're mixing with other people that there's that potential for spread, and the mask is a good tool for it's good insurance to ensure that if someone is infected, that it's less likely for them to spread it on to someone else. So what I would say is that if you're in an indoor environment and you're in the same room with another individual, both people should have masks on, or everyone should have masks on. If you're alone in your office, like I am now with the door closed, it's okay to take your mask off at that point. But when I get up to go to the mail room here in a minute or to go down and check in with our contact tracing leads, I'm going to have a mask on. They're going to have masks on. So whether the public is present or not, anytime you have your workforce together, they should be wearing masks. And at the same time, trying to limit that close contact between employees is always key to when you do have a case. And I think once we have the level of spread that we're seeing in the community now, it's just a matter of when, not if, so that when you do have a case that you're not likely to spread it to other people in the workplace. I looked at some numbers yesterday of our exposures, the settings that are cases that we'd worked where they had exposed other people and where those contacts came from. And overwhelmingly, 53% were household members, but the second highest category was work. So your coworkers are people that we're in contact with for a long period of time every day. And they're, other than just our immediate family, they're at the highest risk of somebody spreading COVID-19 to someone else.
Interesting. So we've had a couple of healthcare providers ask, can you provide different guidelines for healthcare providers? As you stated earlier, there are differences related to exposure, when to work, and when to quarantine.
For quarantine, it's essentially the same unless you're in a critical staffing situation. But on exposure, yes, CDC and Kentucky Department for Public Health both have decision-making matrices that are specific to healthcare workers. And there is some difference depending on than what we're using for the community standard, with the rationale that healthcare workers are trained and accustomed to using PPE every day. They have the right type of mask, they're wearing them properly. So yes, we can provide that, or you can go to CDC's website or kycovid19.ky.gov, follow the prompts for healthcare resources, and you can find those decision-making matrices for healthcare exposures.
Great, thank you, Clay. So if an employee feels like they're not being, that their workplace isn't safe, how do they, what should they do?
So if I'd say first talk to your employer about that. We're happy to troubleshoot and provide any guidance on workplace safety and the protocols for preventing that. The KY Safer hotline, which is manned by the Department of Labor, they will investigate workplace complaints related to safety with COVID-19. And if it's a public-facing business, feel free to call us here at the Health Department. We're happy to assist in providing that guidance as well.
Great. So, and then also as a customer, because we've had several people call complaining on members who just have several employees in the operations not masking. What do you recommend for those people to do? Because obviously the chamber's we can't enforce mask requirements. Right. We can just recommend, but what should individuals do when they see a situation that makes them feel like the rules aren't being followed?
Yeah, so I think, we at the Health Department, Department of Labor, other entities are trying to provide that guidance. We're trying to provide enforcement. Sometimes it's a little overwhelming. So you can report that noncompliance to us. We will try to follow up on that. But I think the most important thing in that situation is that we kind of have a consensus in the community, and we're all working towards that compliance together. I would say don't patronize that business, and let the person in charge know about your decision to do that and the reason behind it. I think most businesses want to have happy customers, and they want to have long-term relationships with their customers. So I think providing that feedback in a polite way to those organizations and those businesses is a good step.
Good, thanks. We have received just a comment from the Western Kentucky Regional Blood Center, and make everyone aware of this. Janet Howard, she wanted to let us know that there is an urgent need for recovered COVID individuals to donate COVID convalescent plasma if they've been symptom-free for 14 days. Our usage in this area is increasing daily. Please pass this on to your employees. So everyone, please, let's be mindful of this. We'll try to come up with some kind of an option to share this information, because we also have a local company who is doing tests for Eli Lilly, and they were asking for people who are COVID positive, symptomatic and asymptomatic, to use in a trial period for COVID treatment. We'll be getting that out as well. But that's good news in our community that we've got so many organizations that are on top of this and leading the country really in some therapeutics and research. Let's see if there's anything else with regards to this that we've received. I believe that's all the questions that we've received. We had one question asking, how are they testing children? Clay, do you?
So we're testing children basically the same way we're testing adults. So we see kids in our drive-through here at the Health Department. The hospital is now also testing school-age children. If they're very young, I'd say call your pediatrician's office and make those arrangements through them. But we've seen positive cases in kids as few as a month old. So children can be tested. Again, unless they're just teeny tiny, we can do it here in our drive-through at the Health Department. The same is now true at the hospital. There was a period in time where we weren't testing a lot of kids, but now we're testing kids just like we do everybody else.
Great, thank you. One more question's just come in. Is it safe for children under the age of 2 to not wear a mask?
I think it becomes difficult for very young children to keep a mask on. I'd say if they're able to tolerate wearing a mask, that would be a good idea, especially when around other people. But we also understand that sometimes that's not practical. So, very young kids like that, if they can't tolerate a mask, then try to keep them away from other people outside of your household. But you have to manage that the best you can.
So a lot of mask questions, and I think they're important because there seems to be just so much confusion about this. If you work in an open office with distances of 10 feet between people, can you not wear your mask at your desk? In other words, should you be wearing your mask at your desk if you're in an open office with a distance of 10 feet between people?
Yeah, so the science is not 100% clear on that. There is a smaller risk of aerosolized spread of COVID-19. So I can tell you what we've told the schools and what the schools have been successful in doing in terms of not having a lot of secondary cases. If you're in the same room, then everybody wears a mask all of the time, even with that spacing. So it's not spacing or a mask; it's spacing and a mask. It's sometimes uncomfortable. You do kind of get used to it. We've got some of our contact tracing leads working together in an open office. They're more than 10 feet apart, but they're also wearing masks. And I work down there for several hours in a row sometimes with them, and I wear a mask the whole time. And you get used to it, and that's what I would encourage in that setting to do.
Okay, great. If your employee has a small grade temp 99.8 but had been 100.5 the day before and doesn't have symptoms, do they need to stay home and get tested?
I would encourage that, yes. So, and unless we know what the cause is, but if they've had a fever of over 100.4 at some point, then we would encourage them to get tested.
And if anybody's been through this of having a positive in the workplace yet, it's better safe than sorry, because once it's happened, there are a whole number of things that you will have to deal with. And so better safe than sorry. It's the thing we use around here. And we have an open office, and we always wear our masks in this office just because we all want to make sure that we can stay well and keep our families well too. Let's see, I believe that concludes our questioning. We've had around 16, altogether about 25 questions. So Clay, thank you so much for being here to help us do that. I want to remind everybody that this weekend is Shop Owensboro weekend. We are going to be doing that for a whole week in order to stagger out crowd sizes. But please know that it's more important than it's ever been to shop locally, to eat locally. Our restaurants, our bars are even doing takeout. The restaurants are doing takeout. Almost all of our boutiques do curbside delivery. They do shipping. Some of them are offering private store hours for shoppers. So please pick out your favorite small businesses and do your best to patronize them as much as you can. We can be safe and do this, but we have to do it. So once this is over with, and it will be, and the end is in sight, we'll have our same small businesses that have fueled this economy and served us and made us really a unique community. So I want to ask you from the bottom of our heart here at the Chamber to do that. And Clay, I want to thank you for being with us today. We will have this it'll be on our website and our YouTube channel later on, so people can go back and reference items. And we do have the quick reference list that you sent us last week also on our website. So thanks for all you've done. We're all here for you, rooting for you, and I'm just proud to have a community that knows how to come together and get through times like this.
Yeah, thank you so much for giving the opportunity and getting that information out to your members. We've got it on our website as well, some one-pagers of what to do if you have a case or what to do if you have contacts, and trying to rely on the internet and getting that information in writing so we can get it to as many people. But if specific circumstances come up, always give us a call here at the health department as well.
Clay, thank you so much. And thanks everybody for joining us today. You take care and be safe.